Hello, everybody. Good afternoon, and welcome once again to a weekly COVID-19 public health update media briefing with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. Welcome. And today, joining the County Executive is Sean O'Donnell, who's Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services, as well as Dave Goatsman, who is a manager for County Stat. Pardon me, Dave, if I mispronounce your last name. Thank you, everybody, for joining us. Reporters, if you do not have permission to record, utilize the chat to request it. And with that, to you, Mr. County Executive, good afternoon.
So I want to thank everybody for joining us today. I'm going to start on a little somber note. William Harvey Siegler passed away yesterday afternoon, just weeks after celebrating his 102nd birthday. And Montgomery County's lost the real civil rights legend, the community and civic activist and a human rights activist. At his core, Harvey was a humanitarian. Last year, I was really honored to rename the County Executive's Humanitarian Award after him and his sister, Inez Siegler Maccabee. And Harvey was a veteran, a mentor, a historian, and a good friend to everyone, including myself. During his lifelong pursuit of equality and justice, his accomplishments included striking down job discrimination and promoting the hiring of African Americans in government agencies like Montgomery County Public Schools and in the Montgomery County Fire Department. Harvey was a Montgomery County Human Rights Hall of Fame member, Dr. Martin Luther King Humanitarian Awards recipient, and African American Living Legend Award recipient, as well as a leader and a member of the Montgomery County branch of the NAACP. Montgomery County's lost a legend yesterday, and our sympathies and condolences are with Harvey's family and friends and all those who we know who knew him and who were inspired by him over his long life. Last fall, during the presentation of the inaugural Inez Siegler Maccabee and William Harvey Siegler Humanitarian Award, Harvey said the following: I'm still trying. You don't give up. If you give up, then you haven't accomplished too much. But I feel like what my sister and I have done in Damascus and for the county and the state, if you don't work together and try to unite together, it's downhill. I've tried all these 101 years, and I feel like that's the only way to do it, is to unite and talk from the heart and try again. If you fail once, don't give up, keep trying. William Harvey Siegler's life and legacy will never be forgotten. Every resident and every community in Montgomery County owes him a debt of gratitude for his life's work to make this county a better, more equitable, and a more livable county for everyone. And now I'm going to go back to the COVID update. As for our COVID update this week, our county's 7-day case rate continues to tick up. Our case rate per 100,000 residents has doubled over the past 2 weeks. Our hospitalizations remain low, but have increased, and we remain in the CDC's low community level due to a high vaccination rate and a low hospital rate. But our community transmission level increased from the moderate level to the substantial level this week. This uptick was expected as the Ba2 subvariant continues to grow in the percentage of cases that are identified, and it's now up to 67% of cases in our region are Ba2. Our case rate projections show continued increases over the next several weeks before levels are expected to peak and then wane again. However, as we experience this increase, we have gotten word from the Maryland Department of Health they're going to be ending the daily COVID data updates and transitioning to once per week data. This change both baffles and concerns me. We are just 2 months removed from the Omicron surge that seriously strained our hospitals, and this data is critical to our constant evaluation of the status of the virus. There have been, articles written, journal articles written expressing concern about this country's moving away from tracking the data and letting people know what's happening. And it's just not right. This thing is too volatile. You have no guarantee that when you think it's over, it's actually over. And we should be as informed as possible so people can make the right decisions. And residents should have an understanding of what's happening around them And the state should, in my mind anyway, be continuing to provide as much information as possible rather than as little information as possible. The good news this week is that our HHS department experienced a 300% increase in weekly vaccination volume after last week's announcement and authorization of a second booster. But we still have 46.7% of our residents not receiving even their initial booster. Next week is MCPS is going to be on spring break, and we expect many of our families will be traveling. We want to encourage everyone to continue to be vigilant, continue to test, report positive results so we can better track the data, and most importantly, get vaccinated and boosted. This is also National Public Health Week. Montgomery County is commemorating National Public Health Week as well as World Health Day under the theme, Public Health is Where You Are. Over the last 2 years, we learned firsthand how important public health and our public health workers are to the county's welfare. Although COVID has gotten the lion's share of attention, our Department of Health and Human Services, along with our state and nonprofit partners, have continued their work across numerous threats that impact our public health, including substance misuse and addictions, domestic abuse, sexually transmitted diseases, mental health, crisis intervention, as well as racism and health inequities. Health is a human right and a priority in my administration. And I want to point out Montgomery County is one of the U.S. News and World Report's healthiest communities in our country. In 2021, we were ranked 65th overall, which is up from the rank in 2020 of number 101. So we continue to improve. This recognition and improvement is due to our county's world-class public health system. I want to thank them for their vigilance, dedication, professionalism while keeping us safe and healthy. And while we're talking about public health in anticipation of a question that'll likely come, our public health officer is in process of being interviewed by the state, and we're waiting to get their blessing on moving forward with his appointment, because this is required that both the county and the state act together on this. Today, we're releasing the findings of the biannual independent national community survey on the livability of Montgomery County. Survey results showed that 90% of the respondents consider Montgomery County as good or excellent when asked about the county as a place to live. And 86% of the respondents consider Montgomery County as good or excellent when asked about the county's overall quality of life. Results of the survey are reassuring that our efforts had a positive impact on people's lives. The increases in favorable responses to questions about the county's livability and quality of life as compared to previous surveys are a testament to the role our government has played in supporting and protecting residents through these challenging times. The survey also asked residents for responses to a variety of specific issues around our economy, public safety, affordable housing, education, arts, and culture. The survey is an interesting reflection of where we are succeeding, areas where we need to improve, but most importantly, how our residents are perceiving Montgomery County as a place to live, work, and thrive for themselves and their families. I'm pleased to be joined today by our county stat manager, David Gottesman, who will go over some of the highlights of these results. This month, we are beginning Earth Month. And on Monday, the latest UN report on climate change was released, indicating that carbon emissions 2010 to 2019 have never been higher in human history. UN Secretary General Antonio Guterres warned it's now or never to limit global warming. And Secretary Guterres said specifically, this is not fiction or exaggeration. It is what science tells us will result from our current energy policies. And we're on a pathway to global warming of more than double the 1.5 degrees Celsius or 2.7 degree Fahrenheit, the limit that was agreed on in Paris in 2015. I encourage everybody to read Secretary Guterres' op-ed that was published in the Washington Post this week, where he cited a litany of broken climate promises that revealed the yawning gap between climate pledges and reality. This is truly serious, and this is something government is just not going to be able to do alone. Uh, we're looking at, within our sphere, we'll be able to electrify our bus fleet. We'll be able to electrify our vehicle fleet. I don't have any doubt of that. We'll be able to make our buildings cleaner, and we'll be able to dictate that the next series of buildings we build are going to be net zero buildings at the very least. We can't guarantee that other people are going to do the same things. Now, we've put legislation, our building energy performance standards are still in front of the council more than a year later. And hopefully they'll get acted on in another week or two. But even those standards are going to take a couple of years before they come into effect. Whether or not a person goes out and buy an electric car or an internal combustion powered car has real impacts on the environment. And you now have available plenty of electric cars, and they're beginning to come down in price, which is important. But there are opportunities to buy electric, and that's something that we need to do as individuals. We need businesses to do for their fleets. There are electric and hydrogen trucks that are, either in the process of actually being used and built, or will soon be available. And we need businesses to make similar decisions. And the same thing is true about personal decisions that we have the opportunity to make in our own lives. I drive an electric vehicle. In another couple of weeks, I'm going to have solar put on the roof of my house. One of the things that, that I looked at that was important is that there's actually a payoff in making the conversion to solar. They're putting solar on your house because of the declining price of solar and the rising cost of energy. There really is a payback period that a person's going to realize in a reasonable number of years. And going solar is just one of those things that we can reduce the demand for power in our grid, which is largely generated by coal and natural gas, some nuclear, and a little bit of clean energy. This is an opportunity to provide your own house with clean energy. People should really look at it. If you look around you, you see more and more solar roofs going up. And I think it's, critical that people think about this and ask, how do I do it? Get the information. Don't assume that it's too expensive. Talk to the companies that are providing it. There are a number of different ways it can be provided to you. But this is an opportunity, and it's something that we need to take advantage of. And this is really going to require all of us to do. We cannot avert climate change unless residents and businesses make some of the necessary decisions on their own, that the things they control, they're actually going to control in a way that makes them cleaner than they are today. I'm done talking about that for right now, but I will be back to it. Bottom line is that we're at a tipping point in combating climate change and reducing carbon emissions. Proposing and prioritizing sustainability can't be limited to just 1 month of lip service and political platitudes. We actually have to do this 12 months, 52 weeks, 365 days a year. It's an endeavor that requires collaboration and cooperation across all levels of government, in every business and corporation, and in each of our homes and lifestyles. And climate change is the existential crisis of our time. I know there are events that seem to keep pushing it out of the headline, but you don't have to go very far on the news, in the newspaper, before you see the stories about what's happening with the climate, the really frightening predictions about sea level rise. And just remind people that, probably 5 years ago when we were talking about this, people were talking about inches of sea level rise. Now we're talking about feet or yards of sea level rise. This is real as it can be. It's going to affect climate. So you could argue that Montgomery County doesn't have, I don't border on the ocean, but the effects of this are going to have profound effects on our weather. I've been very vocal about this, and I'm just hoping that everybody takes this seriously. There's no magic wand. I can't do everything at once, even at the government level, but we're doing what we can to speed this implementation of, as clean a environmental footprint as we can possibly have. and we're working to make it easier for you. We've got a buying co-op for electric vehicles. Hopefully we'll be able to supplement that with some financial support. We've got a program to get people out of their gas-powered leaf blowers and into electric leaf blowers, and we'll give you money to make that transformation. We're working, to provide and help supplement what you can do with actions of our own. And so again, I want to encourage you to do that. We're making progress toward our climate goals to reduce greenhouse gases emissions by 80% by 2027 and 100% by 2035. These goals are among the most ambitious in the country and the world, and our climate plan that we launched last summer is our roadmap for reducing emissions. I'm proud that we've acted on 75 of the 86 recommendations in the climate plan, and we're going to continue to act on more of those recommendations. Throughout this month, Montgomery County will be honoring Earth Month with volunteer community environmental events that are fun, educational, and bring attention to the importance of caring for the environment. And I encourage all residents to visit mygreenmontgomery.org, mygreenmontgomery.org, I think it's .org, for events and how to participate. Annapolis update. This is the final week of the General Assembly's 2022 session. They're on track to pass their capital budget, which includes $10 million allocation to help take further action on capital funding at the WMATA site in North Bethesda. These funds will allow us to continue to grow this vision of an educational and life sciences hub for the region. And I want to thank Governor Hogan for his investment and continued commitment to Montgomery County. The capital budget also includes great news throughout Montgomery, thanks to the hard work of our delegation. Our senators and our members of the House have done an astounding job of bringing resources home to Montgomery County. I want to thank, Delegate Corman and Senator Zucker, who the chairs of their respective delegations they have included over $60 million for bus rapid transit this year to help move this county's landmark program forward. I want to thank the Appropriations Committee for approving $27 million this year to finance the expansion of bus rapid transit. And as the state's leader in rapid transit, we're grateful for the long-term investment in mass transit in Montgomery County. These are big changes, and I just, want the residents to know how much the delegation did, not just in these areas, but in other areas, to help Montgomery County move forward on our objectives. And I just want to convey my real appreciation for their work. And it's been really good to see the productivity that came from them and the progress we're going to be able to make because of that. This month, Ramadan began. I want to wish the Muslim community of Montgomery County Ramadan Mubarak. Ramadan is the holiest month in the Islamic calendar, reminds us of the richness of Islam that it adds to our county's diversity and culture. May those who are observing Ramadan have a joyful fast. And I want to thank everybody here. I want to give special thanks to Lorna Virgili, who's our weekly moderator on her 10th anniversary of Montgomery Al Dia, Montgomery County's Spanish language program show on Radio America, WACA 900 AM. I was honored to be her guest on her 500th episode of that this week. And I want to congratulate Lorna for this pretty amazing achievement and consistency in helping us get our messages out to the Latino community and in relationship bringing their messages back to us as well. So thank you very much. And with that, I'm going to turn it over to Sean O'Donnell and Dave Gottesman.
Thank you very much. I'm going to, I do need authorization to share my screen, please. Thank you. To build off of the information the county executive has shared, we have seen a slight uptick in cases over the last week and a half. And fortunately, it has not had a dramatic impact on hospitalizations, We have had a few additional hospitalizations recorded over the last week. But again, this is at a much, much lower level than we've seen over the last few months. We are hoping that that this trend of increased cases here will follow what I'm going to share with you in a few minutes, has been seen in some other parts of the world related to BA2. We do expect, again, to have some transmission of BA2 here, but we hope that it will be a short-lived and not a high spike. Looking again just at outcomes from the previous spike, to date, we have one recorded death from COVID in this month. Again, we're hoping these numbers, they've been on a downward trend since January, and we're hoping they continue to decrease. Just to highlight again how important the boosters have been. When many people in our county got boosters back in the fall, they did not have a significantly different impact than those people who were fully vaccinated against death, because both were very, very low. Once we had Omicron, we started to see the death numbers unfortunately go up fairly dramatically, with the exception of those individuals who were boosted, and those numbers stayed relatively low throughout this. So again, we're sharing that information to underscore how important it is for individuals to stay up to date on their vaccinations. To follow on with that message, we know that first booster shot eligibility has been available for quite a while. We just want to reemphasize, anyone who is 12 and older, and it's been 5 months since their second dose of vaccination, they're eligible for a booster shot. And those who got Johnson & Johnson as their first shot were eligible after 2 months, which should be almost everyone who got a Johnson & Johnson first dose. For the second doses of booster shots, again, this was being authorized right around this time last week when we were having this conversation. So we wanted to underscore, it is everyone 12 and older who's immunocompromised, and anyone 50 and older at all, as well as anybody who received a Johnson & Johnson vaccine as both their first dose and their first booster. So those are all individuals, and if it's been 4 months since you got your booster shot, you're eligible for a second booster shot. And we have indeed been seeing a number of people coming through our clinics for that second booster. I also just want to remind people that there are antiviral medications approved for COVID, and that you can either get it prescribed by your physician when you see them, or an even easier way to go is to go to one of the locations in the county where they pair testing with the ability to get antivirals if you come back positive. And so there is a link to find where those locations are. We have it on our website. And if someone is feeling symptomatic and wants to get tested, they can find out if they're eligible for treatment right away by going to one of these sites. Just to build off of the update on the BA2 spread, the CDC is now reporting 72% of the cases across the US are BA2, and we know that in the greater metropolitan New York area and the New England area, that's already up to 84%. So we definitely see this as the trend going forward in our region, in our state, and in our county. To give you an idea of what we're seeing, though, we're also monitoring the cases globally. The US and Canada are relatively stable without much change in the case rates increasing or decreasing. Much of the rest of the world, with some exception of a number of countries in Africa, much of the rest of the world are showing some decreasing rates, which is encouraging. When we look at it in aggregate globally, you see that it was a little bit of that very large spike is the Omicron spike, largely fueled by rising cases in the US, in the Americas, and in Europe. And you see there's a second spike here, and that is both possibly the Omicron phase happening in the Western Pacific, as well as some activity in Europe, possibly the BA2 moving through. And we've seen that the European curves of COVID activity have aligned more closely to what we've experienced here. And in looking at it, you do see that secondary peak happening there. It does look like in the last 2 weeks, there's been some leveling of that and possibly even some decrease of that. Just share that these are WHO numbers because they come from so many countries. The data does get updated every week, not just with the most recent week, but previous weeks as they get clarity on the cases. But it's a little bit encouraging looking at what is happening in Europe in aggregate. Some countries are still showing more COVID activity than other countries, but we're hoping that this was a short-lived BA2 spike that they had. Just before I go into the vaccinations, we just want to, again, encourage people. There is COVID activity going on in our county. If you're indoors in an area with lots of other people, we still recommend wearing a mask. We know it's not required, but it is a safer practice to wear a mask in those settings. Going with our vaccinations, again, it's been a slower go with our ages 5 to 11 populations, but they are up to about 61% fully vaccinated at this point. We continue to encourage the parents of this age children to bring them out, make sure they get vaccinated. Again, that will help reduce the spread in your homes, help reduce lost days of school. So we hope this continues to increase. We know this has been slow going though across the United States. We continue to see, again, slow upticks in the additional dose rates. We see our seniors are getting, it's more of them are getting closer to the being fully up to date with boosters. We see more of a disparity, honestly, across our racial and ethnic groups as we go into younger ages. So we're still strongly recommending that everyone who's eligible gets boosted. And again, we hope that it will continue to provide a protective effect against serious outcomes for COVID. As our county executive mentioned, we have seen a significant uptick in vaccinations just at county clinics alone. We're sure this is happening at our private partners as well. But just within a few days of offering the boosters, we've already gone up 300%. And so we're working to make as much vaccine available as possible. And again, happy to see that people are coming out to get a booster. Finally, we continue to distribute rapid test kits out to the libraries, as well as PCR test kits through our rec centers. We know people are taking these home sometimes for a contingency when they may become ill or someone in their family may become ill. Just letting people know that we'll have an update on expiration dates for the rapid test kits. We're researching right now within each of the manufacturers. In many cases, the FDA has expanded the expiration date printed on the test kit, but we're asking people just to be mindful of that. And again, we'll post this on our website when there's been updates to those expiration dates. But again, people have the ability to test themselves, and they're still welcome to come out to a county site or a private provider site who's doing testing. That is all I have today as an update. I'd like to offer Dave Gottesman a chance to share updates as well.
Thank you very much, Sean. Good afternoon, everybody. Let me share my screen as well. I should be able to. Okay, I'm hoping that everybody can see. Okay, I'm getting a yes. Great. Thank you. So I appreciate the opportunity to share with everybody that we are releasing the results of our 2021 biannual resident survey. Just a little bit of the housekeeping. This is a survey that the county does every odd year. The methods, the process mirrors the past number of surveys with a 5,000 randomly selected county household outreach effort. This past year, we had a 12% response rate, and the margin of error is no greater than plus or minus 4 percentage points for any reported percentage. We do, or the firm that we use that conducts this survey and does so for many hundreds of local governments around the United States, weights the responses to ensure that the percentages reflect the makeup of the larger county community. And as people who've been following this for years know, that in addition to the random sample survey, in the name of inclusivity and openness, we allow any county resident to respond to the exact same survey through an opt-in method. However, that the opt-in method, of course, is not a random sample. We do keep those data sets completely separate, and we obviously don't treat the self-selected opt-in survey data set with the same deference as the main survey, which is the random sample. Also pleased to report that in addition to the 3 languages we've offered the survey in the past, English, Spanish, and Chinese, this past year for the first time, we also offered the survey in additional languages, Korean, French, Vietnamese, Farsi, and Amharic. So I have a couple of highlights to share on the next 2 slides, but there is a lot to unpack. The full 178-page report is available as part of the press release, which either has gone out or is about to go out. That'll be certainly a public document. But what struck me as I was reviewing the report is looking at the results through the lens of the pandemic. It was remarkable to see that overall public opinion about living in the county and our quality of life, or the livability of Montgomery County, as the report calls it, remains very strong. One might expect or have expected dips in public sentiment, especially because the survey period was during Omicron, which was completely unexpected. We couldn't plan for because it was a hard-mailed survey and a lot of preparation goes into it. That train had, quite frankly, left the station before mid-November. And, to see the kinds of responses that we got during that period that was kind of fraught with a lot of uncertainty and just a hit that people were taking in terms of health and restrictions and all of that, to me, that's remarkable and rather encouraging. So that said, just a couple of highlights, just literally scratching the surface, and we will be doing additional analysis on the results. We'll be doing analysis on demographic crosstabs. We'll be doing some geographic analysis as well. But at a high level, at a countywide level, it's really encouraging to see that the results for Montgomery County as a place to live, the excellent and good percentages are consistent with the last 2 surveys. Overall quality of life, positive marks ticked up a little bit. People would, 9 out of 10 people who live here would recommend living here to someone who asks. 86% of respondents plan on remaining in the county for the next 5 years. And our overall image and reputation is consistent with pre-pandemic surveys. So to me, that's very encouraging. Now, the survey, of course, goes into dozens and dozens of specific areas of specific services that the county offers. There are themes that emerge in the survey, everything from economic development to public safety to mobility, that people can, certainly dig into, as we will be. I think it is important to note that while we improve or remain consistent in a lot of ways, if we do need to acknowledge that the overall positivity rating of public safety dropped just a little bit, just outside the confidence bounds, the margin of error bounds, from 84% positive to 77% positive. But when you do dig a little deeper into some of the specific questions about public safety sentiments, you see that things, are still consistent with pre-pandemic surveys. People still feel safe in their neighborhoods, in our downtown areas. People feel safe from different types of crime, from natural disasters and so forth. And again, at a countywide level, when people rate the overall confidence in the county government, when people think about if the government is acting in the best interest of the community, those marks ticked up just a little bit, again, within the margins of error, but showed some positive trending. So happy to report all of this. We will be digging into the full report and the raw data over the coming weeks and months, as others may be as well. So thank you for your time, and I appreciate it, the opportunity to share this.
All right, thank you, gentlemen, for those presentations. Thank you, Mr. County Executive, for acknowledging the 10th year anniversary of Montgomery al Dia. You were a great guest yesterday, and it is my pleasure to host and produce that show, which is an additional tool that Montgomery County government has to reach out to the county's population who is Spanish speaking. Reporters, the link to the resident survey is on the chat. You can use it right there. And the first question comes from Steve Monell, Bethesda Beat. Good afternoon, Steve.
Afternoon. I'm going to jump off what the county executive was saying about the data at the state level being shifted from daily to weekly. It appears too that, correct me if I'm wrong, they stopped doing weekend updates as well, but I'm wondering what impact that might have on your all's operations. I guess Sean might be able to weigh in too. And if you've been in conversations with the state to, hey, can we have the data so we can have it on our dashboards, and how that might look?
Yes, no, that is something, unfortunately, we got a taste of that for much of the month of December through the most striking part of COVID case increases. But I'm going to say that we do want the data daily. We do get some of our data daily, and some of the most important data, again, which we've shared throughout that month. The hospitalization data we are able to pull ourselves, and gives us a very close look on what's going as far as serious cases. We also do track on a day-to-day basis the outbreaks in our congregate settings. These are both very sensitive at opposite ends of the spectrum, obviously, but sensitive ways of understanding what's going on in our county. We do encourage these systems, and we'll work with our county staff partners and the state partners to try to make sure that where the data uploads have been automated, they continue to feed into our systems automatically. We do know they won't be sending weekend reports to us, but we're hoping to maintain the automated data feeds of important things like case numbers and vaccination data, which again, we rely on them because they aggregate it from all of the labs and all of the private care providers.
And I can ask the state this, but when they made this announcement, did they give you all any explanation as why they're shifting from daily to weekly?
I would really have to refer to our acting health officer, because I do believe that would likely have occurred within the health officer conversations. So I have not seen that.
And the last question I have is on BEPS. I know County Executive mentioned this again. This is kind of in the House in Annapolis, as far as I understand, and there's a lot of changes that might be made, perhaps preemption, it's kind of a sticky issue. We don't have the full picture, but is there anything in the local BEPS bill that, if it were to be preempted by the state legislation, that you're concerned about? I know that you guys have more kind of, not stringent, but just more guidelines for the BEPS program. So I'm wondering if there's anything in the local bill that you really think might be impacted by the state legislation at this point, if you know. you're muted.
Now unmuted. Anything that slows up the implementation of BEPS is a problem. And so if it's lesser penalties or slower timelines, and if we have to conform to slower timelines in terms of when people have to come into compliance, that just delays us getting where we want to go or where we need to go. I don't believe that it actually does preempt us. We've had pretty clear historical understanding that we're not preempted unless legislation expressly says we're preempted, and this legislation doesn't say anything about expressly preempting us. I know there was a discussion about whether they should explicitly write us out, but they discuss lots of things in the legislative process, and the fact that they discuss lots of things doesn't mean that because they discussed it, that was something they either intended to do, or by not doing it, you had no choice but to also not do it. So we're concerned that of the limiting factor. I don't think we're going to wind up being preempted by it. But I will say the state's timeline is too long. I mean, this is something that, the state needs to work on. 2045 is just flat out too late. I mean, but if we don't get to these targets until the 2040s, we're going to have serious problems already. There's going to be a lot more serious. And, we're trying to be a model because we're acting, ahead of most places in this country, probably most places in the world. And if we cannot make progress on this on a timeline that gives us hope for, reducing some of these horrific impacts, which could come with not meeting our goals, this is going to be problematic for everybody. It's not like you just failed to meet a goal. It has consequences that we will experience in day-to-day life. And, what we need is other people to adopt timelines like ours with the sense of urgency that we have, and not back these timelines up because it may be a little bit difficult because there are some actors that aren't interested in getting in line as quickly as they need to. At some point, you've got to choose the general population and the general well-being of society over a small group of actors.
I guess the bill, though, is kind of silent on the issue, and that's what was being discussed in the Council Committee about whether that opens the door for a legal challenge. Do you have any thoughts on kind of that scenario?
I believe it does not, because we have asserted and it's been true that if we're not expressly preempted, we've acted, as if we're not preempted. And we've been successful with that. So I don't get the sudden, oh my God, they're not preempting you, therefore, or they're not excluding you from preemption, therefore you've got to worry about being preempted. I don't think that's really true. But we'll have more discussions about it.
All right, thank you.
Thank you. Sean, can you clarify when the Maryland dashboard will be updated so we can be clear on this?
I'll have to look into it. I know when we say the Maryland dashboard, we're talking about lots of different data feeds that come from different places. Right. Yeah. There's lots of data feeds that go into that. And we've seen since the cyber attack in December, we've seen those data feeds come back online over time. And in many cases, we've worked with them to automate our dashboard from those new feeds. So we'll have to look into it more. I don't have a lot of information about how which data feeds will be impacted by this. I did just see an email that the weekend updates were not being updated or were not being provided. But I don't have information about the specific data feeds from MDH.
Okay, thank you. Next up is Heather Curtis, WMAL. Good afternoon, Heather.
Good afternoon. Thanks so much for taking my questions. So looking at the survey results that Mr. Gottsman presented, Montgomery County is getting overall quality of life, 86%. People recommend others live in the county, 89%. I mean, these are glowing reviews. But then the confidence in government is 63%. So I'm wondering, County Executive Elrich, why you think there's that disparity and what you can do to, I guess, make people more satisfied that their government is working for them?
Well, I think it indicates a lot of people think the government is working for them. I do think there's more we have to do. I think COVID, certainly contributes for people who didn't like what we did with COVID, which we know is a decent percentage of the population. That's probably a major issue for them. But I stand by what we did for COVID. We didn't do what we did for COVID to get approval ratings. We did what we did with COVID to try to keep people safe. But I think that for those for whom COVID was a very important issue, and they thought that we, like other governments that tried to protect people, were overreaching, I'm sure that affects their perceptions of county government. And I do think there were other issues that, we kind of continuously try to improve. We've worked hard to improve our permitting situation. We're working hard to improve people's experience with county services in general. And we're going to keep doing that. I don't ever look at something like this. I don't even look at good results as a sign that you can stop trying to be better. You look at good results and criticism and figure out, okay, what do we do to put ourselves in a better situation? So
Mr. Gottesman,
we'll
I'm sorry,
continue to do
County
that.
Executive.
So I would say, so we're going to continue to do everything we can to make people feel that they're getting the best services they can get.
And Mr. Gottesman, I'm wondering, did this survey, and I know you included highlights, and I haven't had a chance to actually look at the full survey yet, but did it ask people why their confidence in government was only at 63%?
So this survey does not include any open-ended responses. It's purely a multiple choice type of survey. So the short answer is no, there's no qualitative or narrative type of responses to analyze.
Do you think there may be another survey to try to get an understanding? Because, obviously if it's 63% confidence in government and you guys are doing everything you can to do the best job possible, I would imagine you may wonder, well, where do people feel we're falling short?
Yeah, I think there are potential opportunities to do some follow-up. For something like this, it might be an opportunity to do more of a focus group type of survey. I think most people out there, probably yourselves included, just as residents or customers of any business, are kind of surveyed out. So it makes it a little challenging to keep doing follow-up. But if there was something that, a huge red flag that came out of the survey that was of concern, we would certainly, act on that.
Thank you, gentlemen.
Thank you, Heather. Next up, Stephanie Ramirez, Fox 5. Good afternoon, Stephanie.
Good afternoon, everyone. Thank you for your time. It's been a while. Nice to see everybody. Starting with the survey, just to piggyback on that, the other question I had was with regard to the overall feeling of safety. It appears the survey says from 2019 to 2021, the overall feeling of safety went down. This includes crime prevention, police services, although the evaluation for animal control improved over time. How do you all explain what's happening there, and what can you apply to address that?
I think that, that survey was taken at a time when us and everybody else is experiencing, greater crime. COVID has certainly worsened crime conditions in most of the country. And so I don't find that terribly surprising. I think that, the more incidents that have occurred, the more people, feel less secure. We've had, more than our share of increases in some incidents that people find quite alarming. What you try to do is deal with the incidents and deal with the causes and try to, drive those numbers back down again. I will say that I was just looking at a Gallup poll, you triggered my curiosity about confidence in institutions. 63% for us would actually be really high comparatively. Just as a reference point. There's, Congress gets a 12%, either great or good. There are a lot of groups that Supreme Court gets less confidence than we do. Churches get less confidence than we do. there are a lot of places where, there's decline. I think their point is, there's a declining confidence in institutions.
I think also it was said about 12% of the respondents of the 5,000 sample households, but weren't people also allowed to submit on their own?
Yes. So what we've done with this survey in the past is we do the random sample 5,000 household survey, mailed and online, and then in the name of inclusivity, we share a link so that anybody in the county who would like to take the survey and answer the exact same questions, the surveys are identical, is able to do so. And there is a 3 or 4 week data collection period for that we publicize. This year there were 4,000 or 5,000 responses to the opt-in survey. Those responses are included in the full report. So again, they're there, but from an analysis standpoint, we keep those data sets completely separate. There are some, efforts out there in the survey world to do some more blending of opt-in and, self-selected respondents and random respondents, but the gold standard is still the random response type of survey.
And then County Executive, on another topic, it's been about a month since the Friendly Garden apartment explosion. Where is the county right now on possible legislation to require the older buildings like what we saw here at Friendly Garden have properly labeled utility lines? And how many apartment buildings or units are we talking about in the county?
So I wish Dr. Stoddard were here to talk about that. I can tell you that we're working with WSSC, which is supposed to do well, which has authority, or the Public Service Commission, which is the statewide body that determines regulatory issues. There's questions about whether the county can require this outside authorization from either WSSC or the state. And we are trying to sort that out.
Can I ask you, what would your overall message be? The fact that a month later, you're still trying to work that out. And this is, again, another major incident in a community where there are many people of need in these communities that are impacted, that have been impacted in this way.
Well, I mean, it's the first time anybody's done this where somebody cut a pipe and a building blew up. So this is not exactly something which happens every day. It's a problem that this unfortunate incident highlighted, that it was really clear these pipes are not distinguishable. And we will get to the bottom of who has to make this decision. But like I said, Dr. Stoddard was working on that and he's not here today to discuss it. So I can follow up with you on that.
Thank you.
Thank you, Stephanie. Kate Ryan, WTOP, you're next. Kate?
Yep, thank you very much. I just wanted to circle back on the issue of health officer. County Executive, you mentioned that person is interviewing with state. Can you walk us through the process? What has to happen before we can find out who that is and when they get, take their office, et cetera?
So we always keep somebody's name as confidential as we can until they're actually appointed, for any number of reasons. But a lot of them have to do with the applicants themselves, and they're wanting it to be, private until they actually know they have a job. And so the process for us is, we do the first round of interviews, and we've made a selection. This is our third, we've done this several times. The selection goes to the state, and they confirm that, they'll agree to the joint appointment, because it's a joint appointment between myself or the county government and the state government. So that's the process. So they're interviewing the person, and hopefully very soon they'll tell us that it's a go. But I'm pretty sure they will. He's very, very qualified, has the experience in the right places. We had a lot of discussions about the role of a health officer beyond COVID, because there are other things, for example, that COVID laid bare in the community that weren't related to COVID, but they showed, underlying weaknesses in public health and, disparities in the community. And we wanted somebody who was looking broadly at what they would do as a public health officer, not just convince us that they would have dealt with COVID effectively. And I think that's that's really important, is to have somebody who's going to be working to target a whole range of issues that have been surfaced by our last 2-year experience.
Got it. And when you say the state, what specific body does that?
I guess it's the Department of Health.
Okay.
And then they interview him and determine that he's, suitable to be health officer.
Okay.
They'll send us a nice letter saying yes, and then we'll proceed.
Thank you. Okay. And then, Mr. Gottesman, I'm wondering, again, just getting at first blush into the report, the survey, when you talk about areas of downtown, you had people talk about where they feel safe and in downtowns. Did you compare one to another, or up county versus down county, or how detailed does that get? And is there something you can share with us right now about what that shows?
Thanks for the question. So we will be doing is a very dense document. It's 178 pages to wade through. We have not completed our follow-up and more in-depth analysis. The granularity level for geographies that we'll be able to do analysis at is at the RSC, or the regional service center level. So as you all probably know, the county has 5 regional service areas, and we will be able to subdivide the responses into those 5 areas. So Silver Spring is one of them, right? That's a vibrant downtown. There's a Bethesda Chevy Chase regional service area. That's a downtown, of course. So that's the level of granularity, but we have not done that deeper analysis yet.
Got it. And in terms of, you talked about equity, how, or can you tell, language minorities, did they get a chance to take this survey? Can you identify, did they feel differently about the services they get, et cetera? Is it possible to analyze that?
So that will be part of our follow-up. However, I'll caution everyone that even though we did some different types of outreach this year, and we partnered with our Office of Community Partnerships, and we really pushed out the link for the opt-in survey, from the data that I saw, there was not a heavy raw response number in the foreign languages, with the exception of Chinese, which got several hundred responses, which is all pretty remarkable. But historically, we have not gotten a lot of survey responses in those other languages. Now, remember, we do this if only if somebody's unable to respond to the survey in English. So we don't know if somebody is bilingual, they took the survey in English because that was just, the option 1. But we can see what the responses are in the other languages. But from a representativeness standpoint, if it's too low, I wouldn't have confidence in saying all speakers of this language feel this way. That would not be a correct statement.
Got it. And last, quickly, on the who opted in to take this, you said those responses are separate. So do I look at the actual report is only those who were, that you sent these surveys to, correct?
So the large report that was shared, the bulk of the report focuses on the random sample responses. However, there is a chapter, and I'm looking for the page number, and I don't see it off the top of my head, but there is a chapter that is devoted just to the opt-in, the opt-in non-random responses. That separates that out so people can see those responses on their own, separate and apart from the random sample responses. And I'm looking for that, and I believe that starts on page 109 of the full report.
Got it. And then last question, I promise. Was there anything that jumped out at you that was a real surprise? Maybe not a departure from past years, but something that was like, wow, I would never have thought X or Y.
So in my first reading or two, there was actually one thing that did surprise me in a nice way. So one of the things the county executive just mentioned about how the pandemic exposed fissures in society or inequities or disparities that existed before, but the pandemic kind of ripped the Band-Aid off. One of the topics that's been really important during the pandemic, as most people know, is childcare. I mean, it was the whole industry was thrown for a loop, beyond what many others felt for a whole variety of reasons. So I was actually expecting the people's attitudes towards the question of the availability of affordable quality childcare to plummet in 2021, when in fact the positive ratings increased from about 44% to, I believe, 51%. So to me, again, not an enormous increase, but I wasn't expecting any increase at all in people's attitudes towards affordable childcare, because of what we've all experienced over the last couple of years. People with young kids have really had it bad during COVID. So that was a surprise to me. And then, like we were saying before, just the fact that we didn't drop, precipitously in general attitudes towards quality of life, livability, government, et cetera, not just during COVID, but during Omicron, which nobody foresaw when we were planning this. That was a surprise as well.
Thank you very much. Appreciate it.
Mhm.
Thank you, Kate. I do not see any more questions from reporters on the chat. Going once.
Can I jump in here? Sorry.
Okay, Steve, go ahead.
The county executive and Sean, I'm just being, Twitter, it's amazing, real time these days. I'm being told that the health department's going to do this once every day, every weekday at 10 o'clock. Is there any anticipation? Is it going to be once every weekday and then they're going to transition to once a week, or is this the long-term plan, once every weekday for updating the state dashboard? I just want clarity on that.
Again, I would have to check with the state. I don't know what their long range plans are. I certainly hope it's at least once every weekday.
And I guess the bigger question I have is, obviously I saw the county dashboard was updated to the new low, medium, high kind of distinctions for the CDC. How are you going to use that to make decisions in the future about any potential new restrictions that those need to be taken, and what might occur first, if that makes sense?
Well, I think it depends on what setting we're seeing the activity. Our first goal is to control the spread, and if we're simply seeing disease activity in specific congregate settings, which is usually one of the first indicators, our efforts are usually to work with those locations, make sure that they have the latest guidance. When it's defined as an outbreak, there's very specific measures we take to follow with them, report the cases. We've been doing this now for 2 years with our congregate living facilities. We do it with our schools. So that allows us to be more targeted with those sorts of restrictions. As far as a larger scale recommendations, again, you heard me say today, we continue to recommend individuals wear masks when in highly congregated indoor settings. It's still a safer way to go, particularly if you have underlying health conditions or if you're not up to date on your vaccinations. That hasn't changed. I think the more notable guidance is when there is something like a mandate for masks, or a policy is implemented by public or private sector partners throughout their institutions, things that happen at the schools, or again, things that are mandated across the county. There is, as we've seen with the mask mandates, there's a lot of deliberation, a lot of information is provided from public health. More than just the information that is being used for guidance from the CDC. We certainly want to paint a full picture to our partners before something as impactful as required social guidance goes. So, I would say we're going to look at a number of things. There's obviously, impacts to the wider group of people. when you see rates increase and hospitalizations increase as we did this past winter, it makes a more compelling case for the importance of having masks in all indoor facilities. But I don't know if I've gotten to the heart of what you're asking here.
No, I'm going to shift gears here for the last thing with county executive. County executive, you mentioned there's a name for the health officer position being reviewed at the state level. Was that a part of a pool of 2-3 people? Can you shed any light on what the final round of? Because it seems like we're close, obviously, if one person's being reviewed by the state.
Right. Yeah, we've interviewed a lot of people. And this is the person we've sent on to the state.
Okay, but
That'd be more detailed than that.
But there wasn't a final pool, or can you shed any you pared it down from that?
I mean, there were obviously some people that rose to higher level, got the higher level of evaluation or review than others did. There were, not everybody has the same or had the kind of match for all the things we were looking for. And that's what we sorted through, but we had a number of good candidates.
I mean, you're confident in this choice being confirmed by the state, obviously, then?
I would, there's nothing about his professional background or anything that would indicate otherwise.
And within the next few, I mean, I'm with Gales, I wonder how long it was between the time you sent his name to the state, the time he was approved.
I wasn't involved when that happened. I was a
Okay.
council member. I'm just assuming that it's pretty quick.
Okay.
We would like it to be very quick.
Okay. Thank you, everyone.
Thank you, Steve. Thank you, everybody. I do not see any more questions on the chat. There is some information from the MDH website on our chat right now regarding to the question you were following up on, Steve. No more questions from members of the media. Thank you, everybody, for joining us. We'll see you next time. Stay safe. Good afternoon.